Jessica, and I'll be your nurse for today. Can you verify your name and date of birth?
Alton Sherman, July 17, 1996.
Alright, so your doctor ordered a head to toe assessment today, so that's what we'll be doing. So I'm going to start with your level of consciousness. What year is it?
2022.
Alright, and who's the president?
Joe Biden.
Alright, and so now I'm going to just look at you, check your grooming, you're dressed nice, good hygiene. And now I'm going to check your for alertness and eye contact, good eye contact. Do you have any hearing loss or vision problems? Alright, so now I'm going to be inspecting your hair and your scalp, okay? And what I'm looking for, and I'm just looking for any redness of the scalp, any bald spots. It doesn't look like it, so you're pretty good. Even distributed hair around your head. Now I'm going to palpate your skin and I'm just going to check for your temperature and any scrapes or protrusion on your skin. That's good. Alright, your hair on your arms, even distributed. Any pain while when I palpate? Alright, so now I'm gonna palpate your nails, and what I'm doing is just looking for your capillary refill. Alright, less than 2 seconds. Alright, so now I'm gonna pinch your skin and I'm gonna check for your turgor. That's just checking the elasticity of your skin. I'm doing it on both sides. Alright, so now let's see. Now I'm gonna ask you I'm gonna list 3 risk factors of skin breakdown from the Braden scale. Is activity, mobility, and nutrition. So how is your activity? Pretty good, okay. And do you say, how is your mobility? Do you move pretty good? Okay, and do you think you have adequate nutrition? Okay. Have you had any rashes or excessive hair loss? Okay. Do you bite your nails? Alright, so now I'm going to be inspecting your head and your face, and what I'm just looking for is general size, shape, and symmetry. So it looks symmetrical to me. Just look at your face, no cuts or straights. Have you had any headaches lately? Alright, so now I'm going to do the hearing test, and what I'm going to do is I'm going to whisper a word to you and see if you can hear it.
Go.
Yes. Alright, so I'm just going to look at your outside ear structure, and I'm just looking for any abnormalities or any drainage. Your ears look symmetrical on both sides. Do you have any hearing aids? Any hearing loss?
No.
Alright, so now I'm going to do your eyes, and what I'm going to do, I'm going to shine the light in your eyes, and I'm just going to check for your pupil response. So when I shine the light, I want you to look further back at the wall, and then when I shine the light again, I want you to look closer to me, okay? Look at the wall behind me. Alright, now look at my shirt. Alright, good job. We get you to follow don't move your head, just follow my hand. Alright, good response. Alright, so now that I'm done with your eyes, well, I have to ask you a question. Do you wear glasses or contacts? Okay, so now I'm going to start with your nose. And what I'm going to do is just look on the inside of your nose, make sure no redness or any protrusions or anything. Do you suffer from a loss of smell? What about nosebleeds? Alright, everything looks normal. Now we're going to start with your mouth, throat, and neck. And what I'm going to do first is I'm going to start with the water test. And what I'm going to do is I'm going to get you to drink some of that water. And I'm just going to palpate your, place my hand on your trachea to see how well you swallow. Alright, pretty good. Any difficulty swallowing or pain? Alright, so now I'm just going to look inside your inside your mouth, and I'm just checking for your oral mucosa just to make sure it's pink and smooth on the inside, no redness or anything. Alright, it looks good, no tooth decay, everything nice and pink is what we like to see. And now I'm gonna check your trachea. We're just gonna make sure your trachea is midline, and it is. Alright, very good. Do you suffer from dry mouth? What about sore throat? Alright, so now I'm gonna do a neurological assessment, and what that is, I'm just gonna explain to you the Glasgow-Coma scale. The Glasgow-Coma scale is used to assess the level of consciousness, and it's based on eye opening, vision response, verbal response, and motor response. A range from 13 to 15 is the normal range. Anything less than 8 indicates brain injury, okay? All right, so do you suffer from any brain injuries? What about memory loss or confusion? All right, so now I'm going to start with your respiratory assessment, and what I want to do is I'm going to check your respiratory rate, okay? So what I'm going to do is have you lift up your shirt for me. So what I'm going to do first is I just want you to breathe in and out. I'm going to check your respiratory rate, and then I'm going to listen to your lungs, okay? So just let me get you to breathe in and out. All right, so now, like I said, now I'm going to listen to your brain sounds, your lung sounds. And so before I do that, I want to educate you on turn cough. So whenever you're in the bed, just make sure you turn every so many hours and make sure you cough. So let me get you to demonstrate it. I want you to take a deep breath in and then cough out for me. All right, and we also have this thing called an ascites spirometer. It's a device that you blow into, and you see how long you can hold it, and see how far you can get that dial to go up. This just helps strengthen your lungs, okay? Do you have any shortness of breath? All right. So when you cough, your cough was good. You didn't have no sputum or anything. So now I'm going to listen to your lungs, okay? All right, so everywhere you feel my stethoscope, let me get you to take a deep breath in and out. All right, so now I'm going to listen to your lungs in the back as well. So I want you to turn around for me. Let me get you to cross your arms. Everywhere you feel my stethoscope, let me get you to take a deep breath in and out. All right, lungs sound clear even in unlabored. All right, so now I'm going to start with your cardiac assessment. And what I'm going to do first is I'm going to assess your JVD, which is your jugular vein distinction. And what I'm looking for is just protrusion of that jugular vein. All right, so, well, you have to be at a certain angle. So let me get you to lean back a little bit. There you go. And hold your neck over. All right. That vein looks really good, no protrusion. All right, so now what I'm going to do is, in this assessment, I'm going to listen to your lung, to your heart, to all the lobes of your heart. Do you suffer from any chest pain? Have any chest pain? Okay, so I'm also going to palpate your radial pulse as well as your posterior tibialis tibial, and your dorsalis pedis. So I'm going to start by palpating your radial pulse. Right. Right. And now for your, this is the posterior tibial. I'm just going to find that beat. All right, I'm going to take off your slides. And on the top of the foot is the dorsalis pedis. All right. And I'm going to check posterior tibia. And now the dorsalis pedis. All right. Normal. Okay, and I just want to explain to you other pulse sites that you would normally check, which is the carotid, and then you have the popliteal in the back. You have the brachial, the femoral, and the axillary under the arms. I'm going to palpate your upper and lower extremities for edema now. So what I'm going to be doing is I'm just going to be palpating your arm, and what I'm looking for is how long it takes for your skin to, basically, do you see a dent when I press, or does it pop right back up? Yours look good. All right, now do your legs. Alright, so next, like I said, I'm going to be listening to your heart. And I'm going to be listening with the diaphragm side of my stethoscope. You would listen with the bell side of your stethoscope for patients who you may think have a heart murmur, or on smaller patients. Alright, let me get you to lift up your shirt again. Alright, so first I'm going to start in the pulmonic lobe. And it's over here. Alright, now we're going to go to the Erb's point. Alright, now the tricuspid. And now the mitral. Alright, those sounds are there. No muffled sounds. Those are all clear. Okay, so that concludes our cardiac assessment. Now I'm going to do like a pain assessment. So are you in any pain?
Yeah.
Alright, so how would you rate your pain level on a scale of 1 to 10?
6.
Alright, 5 to 6. Okay, where would you say that pain is located?
My bag.
In your back. Okay, is there anything that you may do that makes that pain worse? Working, okay. Is there anything you do to relieve that pain?
Back brace.
Back brace. Okay, and how long has that pain been going on? Couple weeks. Alright. So now I'm going to start with a gastrointestinal assessment. So what I want you to do is lay back for me. And what I'm going to be looking at is your abdomen. And what I'm looking for is any protrusions of the abdomen. Just looking for any redness. Everything looks good when I assess. Do you have any pain, nausea, vomiting? All right. And now what I'm going to be doing is I'm going to palpate each lobe of your abdomen, okay? All right. So first I'm gonna start with your right lower lobe. I'm just gonna press lightly. Does that hurt? Do you have any pain here? Alright. And then I'm gonna go to the right upper lobe. Now the left upper lobe. And now the left lower lobe. Alright, so now I want to ask, when was your last bowel movement?
This morning.
This morning? Okay, good. Any passing gas with that or excessive flatulence? Okay. Alright, so now I'm going to start with your mucoskeletal assessment. Yeah. So what I'm going to do is be checking your range of motion, the range of motion in 2 upper extremities and then 2 lower extremities. I'm also going to be checking your gait and balance with this assessment. I want to ask a question. Do you have any joint pain? Alright, so let me get you to stand up and I'm going to check your gait. What I want you to do is just walk across for me. Alright, good job. So what I want you to do now is I'm going to be checking your balance. Let me get you to come to me. So I'm going to be checking your balance. Let me get you to feet together, arms by your side, and I want you to close your eyes, and I'm going to hold on to you, but in a minute I'm going to let go, okay? So 1, 2, I'm going to let go. All right, pretty good balance. Okay, you can have a seat. All right, so like I said, I will be checking your range of motion in 2 upper and 2 lower extremities. So what I'll be doing is doing your elbow. So I want you to do your elbow this way, and just like that. Okay? Flexion, extension. Okay? Get you flexion, extension. All right, good job. And now I'm going to be checking the strength of those. So I want you to flex it up against my head. Okay, good strength. Extend up against my hand. Okay. Same thing on this side. And now I'm going to do your wrist. So I want you to flex, extend, hyperextend. Hyperextend. That 1, 2. Hyperextend. And now I want you to do it up against my hand. So you're going to flex, extend, hyperextend. Okay? I want you to flex, extend, hyperextend. All right, good job. Now I want you to also do these work. Good job. Any pain with that? All right. So I'm just going to be feeling the joints for any resistance or popping. Again, with your knees. So I want you to extend your leg. Flex, extend, and then hyperextend. So flex it, sit up a little bit. So I want you to flex it back, extend, hyperextend. All right, any pain with anything with that? So now I'm gonna let you do it up against my hand. Flex, extend, hyperextend. Good job. All right, so I want you to flex, extend, hyperextend. All right. Now I want you to do it up against my hand. Flex, extend, hyperextend. Good job. No pain or discomfort while doing that? All right. So let's see what is next. So I'm just going to ask you some questions, and this is like a janitorial assessment. Do you have any difficulty urine? Any itching or anything down there? Okay. Well, that looks like it concludes my head to toe assessment for today, and your doctor will be with you in just a moment, okay? All right, thank you.